practitioner here at this walk-in clinic. I see you're on crutches.
Yes.
What happened?
So I was practicing at soccer like 2 hours ago,
Oh,
and I crashed into one of my teammates, and I fell, and then he fell on top of me, and I heard like a loud pop. So
Gotcha.
here I am.
What did you guys do after you heard the pop?
Well, I got off the field, and then it like started bruising and got swollen like 5 minutes or so afterward, and then we did the whole. I stayed off of it for a little while. I put some ice on it.
Okay.
I put my trainer put some that wrap thing on.
East wrap stuff. Okay.
And then we elevated it.
Good. Sounds like you guys did the perfect stuff.
Yeah.
I forgot to ask you, what's your name?
Benny Gonzalez.
Okay. How old are you?
18.
All right. So you kind of described the whole situation that happened. How long have you played soccer for?
Pretty much the entire since I was like in middle school.
Okay. Have you ever been injured before?
So I had a sprained ankle 2 years ago the same way.
Gotcha. While you were playing soccer?
Yep.
Okay. Any other health history, any times that you've been in the hospital?
Nope.
Okay.
Just that sprain that I had 2 years
No
ago.
broken bones?
Nope, but I just had to rehab my ankle for 6 months when that happened the first
It's no
time.
fun.
No, it was not a good time.
Yeah.
Took me out the whole season.
Yeah. All right. Can you tell me if you're having any pain?
Yeah, like right now it's like an 8. And if I move it's like a 10. And it's really hard to walk, like even like 2 steps.
Okay.
Without.
Are you putting pressure on it?
No, I can't put any
Can't put any
weight on it.
pressure? Okay. And where is the pain coming from?
Like the lateral or the side of my ankle.
Okay. Does it go anywhere?
No, it doesn't radiate.
Okay. All right. And pain started right when you
Yeah,
were running.
like within 5 minutes of
Okay.
it happening.
When you put the ice on there, you elevated it and you started wrapping it. Did that help the pain?
A little bit, yeah.
Okay. And you said putting any weight on it makes the pain worse.
Oh, yes.
Increases the pain level.
Yeah.
Okay. Have you taken any medications
No.
for the pain?
No.
Okay. Do you take any medications? All right. No over the counter?
Nope.
Any herbal supplements?
No.
Okay. Alrighty. And do you know how much you weigh?
I weigh like 165 pounds.
Okay. And how tall are you?
5'10".
All right. Any allergies to any medications, including penicillin?
Just penicillin.
Okay. Do you know if you have an allergy to latex?
No.
Anything in the environment?
Mm-mm.
Any foods?
No.
Okay. Alrighty. We already went over your medical history. What about family history? Any illnesses in your family?
I don't think so.
Okay. All right. I'm sorry about that.
It's okay.
Do you drink any alcohol?
Nope.
All right. Drink any caffeine?
No.
All right. Any drugs?
No, but my friends always tell me that I should do steroids since we're in soccer and it would help me. And I've thought about it because what would it hurt, but I never did it.
Yeah, that's a good choice. It can have lifelong consequences on your heart, and things like that. So you're making good choices. Any tobacco products that you use?
No.
Good. Okay. Alrighty. Any shortness of breath?
Mm-mm.
Any pains in your chest?
No.
Alright. Any recent changes in your weight?
No.
Okay. Any nausea? Like you feel like you're gonna throw up?
Mm-mm.
Okay. Alright. Any problems with balance before this happened? I know you're probably having a little problems with
no.
balance right now.
No.
Any numbness or tingling?
No, just pain.
Okay. Any muscle cramping?
Nope.
Okay. And any history of weakness before this?
Probably after I sprained it that first time, I feel like it's been weaker.
Okay.
So-
Just not as strong as it
Yeah.
was before. Do you remember when you sprained your ankle the last time if they told you what grade it was, whether it was +1, +2, +3, the sprain?
They said it was a grade 2.
Okay, alright, sounds good. I'm gonna help you with your crutches and I'm gonna help you up to the exam table so I can get a good assessment on you. Alright. Okay, poor thing.
I'll just go this way.
Alright. You know what, we should have taken your temperature and your pulse over here, but we can do it now that you're sitting up here. So I'm gonna put this underneath your tongue. Very good. Alright, 97.2. I'll bring the blood pressure cuff to you.
Okay.
and I'll have you uncross your feet if possible. I know it's kind of painful, but. Good, 110/60. Okay, I'm going to. Good, 72. So I'm going to have you move your wrists in and out, side to side. Same thing with your shoulders. Can you move them up and down, arms up and down, side to side? Very good, okay. Can you move your neck side to side as well? And chin up and down, very good. I'm gonna take a listen to your lungs here in the back. Can you take a deep breath in and out? Good, and over here on this side? Good. And again over here? Down. Good, and another deep breath? Very good, okay. Deep breath. Okay, I'm gonna listen to your heart so you can just breathe normal. Very, very good. All right, I'm gonna lift this up just slightly back here. Okay, can I help you lean back a little bit? All right, and then try to grab this very gently here. Can I help you scoot up just a tad on this? Sure. Okay. Just have to adjust one thing here. All right, I'm going to feel, normally I would lift up your gown for this. Just feeling, for your heartbeat. Good. All right. I'm gonna take off your ACE wrap and ice if that's okay with you. Okay. All right, they did a nice job wrapping that.
Yeah, my trainer's pretty good.
Yeah. All right. I'll leave that. Oh, that's okay. I'll leave that right here. Can I take off your shoes?
Sure.
Okay. All right. First, I'm gonna feel your non-injured ankle and do some range of motion so I can get a baseline of how you normally are. Okay. All right. All right. So I'm going to hold right here and kind of just move up and down. Any pain with that? Okay. And side to side here. All around. Can you flex? Very good. Any pain with that? Okay. I'm gonna feel for your pulse. Very good. All right. I can see there's quite a bit of swelling here. I'm gonna feel for the pulse on this side. Can you wiggle these toes for me? Good. Any numbness or tingling while you're doing that?
Yeah.
Can you feel my fingers here? Okay. All right. So, like with the other foot, how I moved it up. So like I did with the other foot, how I was moving it up and down like this and supporting. I'm going to try to do that with this foot though. So if I am hurting you, please let me know and I can stop right away.
Okay.
Okay? All right. So.
Yeah, that really, really hurts.
Okay. I'm going to try to tilt it out a little bit, and if that hurts, then.
Okay, ow.
Okay, all right. Going to put this underneath here. All right. Lots of pain?
Yeah.
Okay. All right. I'm gonna feel for the structures here. I don't feel any bones out of place, but I am gonna order an x-ray just to be certain with all of the swelling. Your ankle does not feel very strong with the little bit of motion I was able to do. I do suspect that you probably have a sprain. So the treatment for that, I'm sure you are familiar with, but
Yeah.
I'll go over again. It'll be resting for at least 24 hours without putting any pressure on the area. I will redo the ACE wrap, and that's gonna help reduce the swelling. The more swelling you have in the area, the more pain, the more damage to the soft tissues and nerves, things like that.
Yeah.
Ice 20 minutes at a time, and then give yourself a 30-minute break from the ice. And last but not least, you can use some ibuprofen, and I'll give you a prescription for that as well. Ibuprofen is good because it helps with the inflammation and decreasing the pain that way.
Okay.
Okay.
Do you know how long I'll be out for? Like of soccer?
At least a couple of weeks. I'm gonna see you back here in 5 days, and we'll reevaluate from there. But if the swelling worsens, if you lose feeling in your toes, I want you to, if it's non-clinic hours, I do want you to seek care at the emergency room though.
Okay.
We will evaluate, like I said, the x-ray results. I can help you sit up, and then I do have a couple of health things I do wanna go over with you. I'm gonna support your ankle right here. Okay. Bring this down, now that it's all nice and wrapped. Have you had your yearly flu shot yet?
No.
Okay, alright. If you'd be willing, we'll give you one of those today.
Why?
It's a good preventative measure to have every year, so you don't get the flu.
Okay.
Alright. Do you wear your seatbelt when you are in the car?
Not usually, so don't tell my mom.
Okay. Oh, I won't. I do want you to try to wear that every time you are in the car though.
Okay.
Okay. Do you have any other questions for me today?
No.
Okay. Alright. Well, we'll get that x-ray ordered right now, and we'll go from there.
Alright, sounds good.
And I'll help you get off the table.
Okay, thank you.